Today we're going to take a little bit of a different look at training. We all want to be stronger, we all want to maximize our performance, especially if we want to play sports or be active. So I thought for today, what I want to do is present you with 3 simple tests that you can do on yourself to figure out how to improve your training, both for sports and for weightlifting. Pretty easy to do. Let's get started. Okay, let's jump right into this. I don't want you to overthink this. You need a chair. And you're just going to do what we see here in the video. So you see me sitting here on the chair. Both of my feet are even and square. And what I'm going to do is I am going to ask you to show me your hands like that. And then I want you to use one leg and stand up. Sounds weird, but don't overthink it. Once again, show me your hands, both legs down, and then lift one leg and stand up with the other leg. Why are we doing this? We are actually doing this to test to see which of your legs are preferably the more stable of the two. So the question now, which leg did you use to stand up? With me, it was my right. All right, people, test number 2. You're going to need a ball for this. And once again, don't overthink this. So here I am with the ball. You're going to take a ball. And what I want you to do is I want you to kick the ball and try to accurately hit an object. So in this video right here, I'm going to take that ball and try to hit that little garbage can right over there. Very exciting stuff. Here I go. Bang. So, which leg did you use to kick the ball? We're going to take that and we're also going to note that. So with me, it was my left. Okay, you guys, this last one is easy. The last question. Drum roll, please. Which hand do you use to brush your teeth? So let's note that as well. We'll put that on our chart right there. So why do we want to know all this, and how is this going to direct our training? So these tests are going to tell us that we need to train our non-dominant side in order to perform better. And what do I mean by this? Let's take, for example, the brushing teeth. I brush my teeth with my left hand. I want to train my right hand. Here are some examples right here. Make yourself use your non-dominant hand to do things and make it frustrating. Your brain will learn and your neuroplasticity will improve how you use that non-dominant side. Okay, so now let's address the legs or lower extremities. Notice we had 2 tests here. We had one test, which was the sit to stand. And what that's going to do is that's going to give us a quick picture of which leg has more drive or more power. And the other test was kicking the ball. And that's going to tell us which leg is going to have more coordination. Now realize here with most people, and there is some evidence-based research that backs this up, the leg that is the more powerful one and the leg which is the more coordinated one are most often not the same leg. So it's good for us to know this because this too is going to direct our training. So I'm going to show you one training video now of me working on a BOSU. And recall from my tests that my left leg had less power and my right leg had less coordination. So what I'm going to do here is I am just going to get up on this BOSU on the side that has less power, or my left leg. So here I am getting up onto my left leg and working that strength. As you can see, I'm trying to get my balance. And then once I've got my balance, I'm going to take my right foot, which is lacking the coordination. And you can see there, I'm trying to touch those weights on the floor with my right foot to develop more coordination. So there we've got one exercise. And it's killing 2 birds with 1 stone. I'm working on my power on my left leg, and I'm working on my coordination on my right leg. So ladies and gentlemen, these 3 tests are just a quick and dirty way of determining how you're deficient. And the nice and easy thing here is it really directs how you can train for sports and how you can train to avoid injury. And one last little concept here is I see patients in the clinic all the time with the lower extremity, both their power and their coordination come from the right side. And if you think about this, when that happens, you are left with a left leg that is neither strong nor coordinated. So guess what? If you fall into that category when you did these tests, you have some work to do, my friend. So work on your deficiencies and see where it gets you. You'll be glad that you did. Thanks for watching Angry Physio. Subscribe to us and look for more tips and tricks in the future.